My name is Nathan Boykin, and this is my presentation on chronic traumatic encephalopathy for Bio 168. So, chronic traumatic encephalopathy is seen in patients primarily that have had repeated brain injuries and trauma to the brain. Now, it is not to say that a patient that has only had one significant TBI or traumatic injury to the brain cannot develop chronic traumatic encephalopathy, but it is seen a lot in patients with repeated trauma, such as athletes, military personnel. So, things I like to cover in this presentation are what is CTE, what causes CTE in the brain, physiology of CTE, testing and diagnosis of CTE, who is affected by CTE, prevention of CTE, and potential treatments of CTE. So CTE is a neurodegenerative disease that is suspected to occur in patients after repeat trauma to the brain. Signs and symptoms of CTE can be depression, memory loss, changes in cognitive ability, behavioral issues, mood swings. I think we've all heard about CTE on the news and how that has affected a lot of NFL players and college players. And unfortunately, when we're hearing about this, a lot of times that has been due to suicide, or maybe people maybe killing somebody else, and then they go back and look at these people's brains after they've died, and they're able to see these different formations in the brain that are believed to be related to the disease of CTE. Now, CTE is believed to be broken down into 4 stages. Typically, your 1 and 2 are when you're seeing your mild stages of CTE, as in depression and memory loss and mood changes. And then in your more severe cases of CTE, you're seeing things that are more closely related to like Alzheimer's, dementia, ALS, Parkinson's disease. That is because CTE kind of all plays into these types of diseases that related to tauopathy and release of a protein in the brain known as tau. So tau, when it's released in the brain and broken down, causes these neurofibrillary tangles in the brain. And you see that a lot on your Alzheimer's patients. And so this is thought to be caused by when the brain suffers trauma, there's a breakdown of tau, which is a protein that protects the microtubules on the neurons and axons on the brain. Now, tau, once it's broken down, a known as GSK is released. And this is a stop mechanism. So the stop mechanism is trying to stop the breakdown of tau. Unfortunately, it causes some deposits of tau in the brain, and these deposits create the NFTs. And so when tau is broken down and these NFTs are created, it can disrupt the communication in the brain through your neurons, and that is thought to be what is causing these signs and symptoms of CTE. Now, there's another chemical that is called RTK that is thought to reduce the amount of impact of GSK and the breakdown of tau, so that it's not happening every time somebody gets hit. But unfortunately, it only does so much. Now, there is thought that maybe RTK can inhibit GSK3, and maybe there are some potential treatments with that I will get on to later in the slide. So as we look at a normal brain here and a brain that is suffered advanced CTE, you can see some substantial changes there. Typically there's a shrinkage of the brain. You have some expansion of vesicles in the brain, along with you see some spaces in the gray and white matter in the brain, and those are telltale signs of CTE. Now, CTE can not only be diagnosed primarily when a patient is during autopsy of a patient's brain, is really when you're able to study and see what's going on. Fortunately, you cannot see these changes in the brain on a living patient, which is definitely unfortunate. And so you're typically trying to diagnose a patient based on previous medical history and history of brain trauma. So typically these patients are assuming that these things that they're experiencing maybe are coming with age and maybe have been from amount of concussions and stuff. But when patients are experiencing this stuff, there is no way of fully testing that a patient has CTE on a living patient, which hopefully maybe later on there could be some ways to get an MRI or a CT scan of the brain and be able to see that on living patients. But right now, that is not something that can be done. So what can be done is a lot of letting these players and people that may be susceptible to CTE know what to look out for, and for patients' families to kind of be doing the same things, and for doctors and clinicians to be able to ask the right questions to maybe be able to lessen the impact that CTE has on these patients. So those that are typically susceptible to CTE are a lot of times athletes that participate in contact sports, such as football, boxing, soccer, hockey, are definitely at the greatest risk. Now, military personnel in combat zones are known to potentially be susceptible to CTE as well due to blast injuries and TBIs related to that. There was a study done that was done on former players in the NFL donating their brains after death, and 87% of those brains were seen to be affected by CTE, which is a shocking number. But not only NFL players are seen to have CTE. I mean, you're at really any level of these contact sports, people are seen to be developing CTE. So we go into prevention of CTE. So it's thought that prevention really starts at educating these players, their families, organizations, coaches about ways to prevent CTE. So really having proper equipment, proper helmets. There's been a lot of different designs on helmets to lessen the impact when hit on the brain, along with proper techniques on tackling and ways that players come in contact with each other. There's a lot of rules around that now to prevent the repeated trauma to the brain. Another way that has been talked about, especially for around football, is maybe doing less practices that are causing the amount of trauma to be going on. So, having light practices and practices that are not involved with tackle practices are thought to maybe reduce that amount of many times that players are getting hit in the head. And then really there's limited amount of research that has been done on the prevention, what CTE is, and treatment for CTE. So really there needs to be more funding and research done on CTE. There currently are no known treatments of CTE. So some potential treatments plays back to what I was talking about before on GSK and RTK, and maybe inhibiting the amount of GSK when it's released. But really, right now, that there are some studies that have been done in relation to Alzheimer's treatments that I thought maybe there could be some potential for CTE impact, but unfortunately, there's not been any clinical studies that have shown success in that on patients. So definitely something that we can hope for in the future. CTE is a fatal disease of the brain. There is no known treatments for CTE. There's no way to diagnose CTE, and there needs to be more research done on prevention and treatments of CTE. Thank you for listening to me ramble on here. Hopefully, you might know a little bit more about CTE from this presentation. And these are some of the